Hi, this is Mythia Ford with RenalDietHQ.com, and today I'm going to talk about renal diet basics for non-dialysis patients, which is also known as pre-dialysis. So I'm going to go over a few basic rules that you can follow as part of a pre-dialysis diet. You should be seeing a nephrologist, and this is coming from a dietitian and someone who's seen lots of renal diet patients. Nephrologists will get you on your medications and get your disease process under control. If your regular physician has told you that you have kidney disease, regardless of the stage 1, stage 2, stage 3, whatever, you need to do what you can to get a referral or to go see a nephrologist. They can help you and look at everything that you're doing and make sure you're on the right track. That's a key to slowing down the progression of kidney disease and keeping you from going on dialysis too quickly. Nephrologists have studied kidneys and kidney disease extensively. They see all kinds of patients. They see people with kidney disease. They see people with diabetes and kidney disease, with heart disease and kidney disease. And they're going to use their specialized knowledge to guide you down the right path. They will help you immensely. As a dietitian, and as what most research shows, nutrition is key. On our website, RenalDietHQ.com, you can find more extensive articles about each of these categories, but calories are important to understand. You need to eat a reasonable amount of calories. If you're overweight, you need to do what you can to lose a little bit of weight. It'll help you both if you're looking for a transplant, but also just to move easier, to get around easier. Your functioning will decrease as your kidney disease gets worse. So making sure that you're watching your calories and trying to stay healthy. Protein is the second most important component in a healthy kidney diet. Healthy kidney diet. Protein is the second most important component. So calories are very important. Protein, you should be doing about 0.8 grams of protein per kilogram. So if you weigh 100 kilograms, you should be eating about 80 grams of protein for the whole day. 1 ounce of protein, for example, if you're eating chicken breast and it's a 3-ounce chicken breast, 1 ounce of protein has 7 grams of protein in it. So if it's 3 ounces of chicken breast, it has 21 grams of protein, which is 1/4 of your daily allowance. Therefore, you would eat probably about 3 ounces at a meal. You're also going to eat, some snacks and stuff. Portion size I just discussed with protein. Fat and calories, eating the right kind of fat. Yes, you're probably going to eat a little more fat just because it is something that adds calories to keep you healthy and does not have potassium and phosphorus in it. But fat, you need to eat the right kind of. So you're going to want to eat the polyunsaturated and monounsaturated fats and not the saturated fats. Saturated fats are solid at room temperature, which is what makes them easier to recognize, like butter and margarine. Olive oil is going to be a better one for you to eat. Sodium, fluid retention and strain on your heart and kidneys. Your body's having a hard time dealing with everything it gets now that you have kidney disease. So you need to try to give it an easier time. Sodium, if you have heart disease, you need to lower it. It can lead to fluid retention. It can strain your heart and kidneys. It can cause you problems. Potassium, watch your potassium based on lab work and your needs. Not everyone has to restrict their potassium levels or their phosphorus levels. So don't restrict it before you need to. If your doctor hasn't told you to restrict potassium, don't worry about it. But you do need to restrict protein and you do need to restrict sodium. But watch your potassium based on your lab work and what you need to eat. Phosphorus is another component, and it's in many foods. It's in all kinds of foods, in basically everything. And you need to know your high and low phosphorus foods. You need to manage them well. You can get more information on our website. We have lists of low potassium, high potassium foods. We have lots of recipes. You can sign up for our email list over there and sign up to get tips on tricks on useful insight. We have information for all different kinds of renal diets at renaldiethq.com, and we have tips and tricks for pre-dialysis, for renal diabetic, which is a very common problem as you're diabetic. A lot of people with diabetes do develop kidney disease, and then dialysis diet meal plans. So I would love to help you. Come on over to the website, sign up for the email list, and let's see what we can get you some good information and get you on the right track. Thank you again. This is Mathia Ford, and I appreciate your time.